Hi, this is Dr. Santhi Vardhani, Proctologist, General Surgeon. Now today I want to talk about a perianal abscess. Peri means surrounding of the anus, perianal abscess. There will be a collection or a swelling or a hard mass-like structure with fever, pain and some color change, sometimes pus discharge from the anus. These are the signs usually for the perianal abscess. Once the perianal abscess is there, then we can tell them to the patient that this perianal abscess is an acute form of the chronic form of fistula. So the first starting point is the perineal abscess and the ending point is the fistula. So once we are dealing with the perianal abscess, we have to know that the patient will land up with fistula afterwards. If the patient comes to a senior proctologist or a senior general surgeon, they can operate perianal abscess and the fistula in a single go. If it is not possible, then the perineal abscess, the operation is entirely different thing. With small incision, without giving bigger cuts and bigger wounds, we can operate and we can remove entire pus with a small incision, with a suction and a laparoscopic instruments. Then afterwards, we can take a call for the fistula if fistula establishes. Usually 99% of the cases in perineal abscess will land up with fistula in ano. So majority of the times patients come to us and they tell us about we were suffered with perineal abscess. At that time we don't know that we will land up with the fistula because maybe the diagnostic part was not properly done or MRI was not properly taken, or because of the severe edema and the swelling we cannot able to diagnose fistula at the time of the perineal abscess. But as a senior faculty, senior surgeons can identify what is the perineal abscess exclusively and what is the fistula, the different form of the fistula, we can establish it. And in the females particularly, the perineal abscess usually occurs in the anterior aspect because the fascia travels from the anus to the vaginal side. So dealing of the perineal abscess in the females is a bit tricky and it should be dealt in some other way than the male because the female genital organs or genital structures are very tender, delicate, and we have to go with a gentle approach. So mind you that once you are suffering with perineal abscess, MRI is the diagnostic choice. We can see properly what is happening there in the perineal area and we can say whether it is a fistula or not, and we have to deal early. Then the problem we can deal within 1 or 2 days. The patient can go again to their routine activities. If the abscess is a long time, roughly around 1 week, after that if patient is presenting to us, then the patient will have a lot of septic inflammatory changes and it is difficult to give a good result if patient doesn't come early to the doctor.
Like, comment, and subscribe for more health updates.